Well, I think the surgical procedure would be better than the conservative approach, especially seeing how you said the pretend patient had already tried in vain to return to sports after doing sport-specific training. And additionally, I believe the suturing repair is better than the mesh approaches. It is possible that the mesh-related complications may occur post-surgery, such as infections or mesh migrations. And the mesh may also lead to localized stiffening of the abdominal muscle walls.
I disagree. I'm pretty sure that the open mesh would be best. The mesh allows for tension release. If you just suture the area together, I think you're not addressing the real problem, and there might be more complications. I also think the open mesh repair would be better than the laparoscopic, because the open mesh only needs local anesthesia.
While the laparoscopic approach requires general anesthesia, it allows for a broader view of the anatomy than the open procedures do. You can use the laparoscope to inspect the bilateral side, checking it for damage or weakness, allowing for a preventative reparation of it at the same time if necessary. This will decrease the risk of reoccurrence of a sports hernia in the bilateral side in the future. Additionally, smaller incisions that don't require cutting through the muscle means less recovery time, allowing athletes to get back to playing earlier.
That's some good discussion, guys. Good discussion. So, I think everyone has a pretty good grasp on the situation. But how do we actually resolve this? We have to look at the evidence. So what are the most important outcomes for an athlete? Shane.
Yes, time to fully return to action, post-surgical improvement in function and pain.
Nice, nice. I'd also add to that surgical complications and reoccurrence rate. Now what we have to do is we have to go out there and find the evidence. So tell me about the outcomes of the conservative treatment.
I can do that.
Okay.
Well, the outcomes for the conservative treatment aren't really that good. I found an RCT, randomized controlled trial, that compared the laparoscopic mesh placement to a conservative treatment. So this is pretty high-level evidence I'm going to give you right now.
All right. Let me write this down.
All right? Well, 1 month following treatment, 0% had complete relief of pain, and only 20% made a return to sport at pre-injury levels. This article also noted that after the study period, most of the conservative group actually opted for the laparoscopic surgery.
And do we find any information on reoccurrence rate?
Not really, because the treatment was not very successful in the first place.
Fair enough. Let's just call that a high recurrence rate. Now we need information about open suture repair.
Prospective cohort trial involving athletes and non-athletes, the effects of open suture approach were investigated with a 4-week follow-up. For the professional athlete, subgroup 86 patients, there were no major post-surgical complications, only minor ones associated with general surgery, i.e. swelling of the area. And within the 4 weeks, 83.7% were then able to return to sports fully, with the average time of 14 days. Also, 80% of the athletes had complete relief of pain within the 4 months as well. There was no reoccurrence rate within the time they were followed up.
Now let's move on to open mesh repair.
I think I can help you out with that one. The complications, obviously with open mesh, are the possibility of infection with surgery, as well as the mesh. There may be mesh-induced fibrosis, infection, or entrapment of other tissues, such as nerves. Also, with open mesh repair, the time to return to action is on average 24.5 days. Also, 76% of the people that had the open mesh surgery recovered within the first 6 weeks. Additionally, 88% made a full recovery within the first 3 months after surgery. The reoccurrence rate for open mesh surgery repair is 1.15% with a 1 to 3 year follow-up. That's RCT-based evidence.
Good, good. Finally, let's talk about laparoscopic mesh repair.
There are several complications possible with the procedure, but the risks of them occurring are each very low. The risks associated with general anesthesia, which are greater than those of local anesthesia. There are also intraoperative risks related to the placement or inflation of the operative balloon and include the risks of damaging the bladder, bowel, or vascular structures. There are also mesh-related risks as previously described. However, the risks related to the surgery are all very minimal. The average time to return to action is 21 days or 3 weeks, with some athletes returning in as little as 1 week after treatment. An RCT study between laparoscopic mesh repair and conservative treatment found that around half of the participants had relief of pain after a month, and almost all had no pain after 1 year. More importantly, 95% were able to play at pre-injury levels after 3 weeks, and there is a very minimal reoccurrence rate shown by studies having followed post-surgical patients for up to 3 years.
Okay. Well, looks like we've got all the information we need to make an informed decision. So let's get back into groups of fours, and we'll have one more group discussion and come up with a final decision on which treatment we should do. Okay, we have an agreement. So let's do a post test. What are the 4 types of treatment and which one is best?
The 4 treatment types are conservative approach, open suture repair, open mesh repair, and laparoscopic mesh placement. And the best one is laparoscopic mesh placement.
Perfect.
Hey, you're back. Hey, man. Yeah, I just got surgery 4 weeks ago and done the physio and it's feeling great. Let me show you how good my kick is now.
Let's do it.
Yeah, go long.
Nice.